Perfect. Thank you. And I think the other counts were, does multiple myeloma spread? And who's at risk to get myeloma?
Right. Can myeloma be in other parts of the body? So it can. And so we talked about bone lesions a lot, and that is one of the myeloma defining events, but it can be elsewhere in the body. So when I think about myeloma, kind of the solid part of myeloma or tumors related to myeloma, bones are the most common place where those can show up. But there are a subset of patients who develop myeloma elsewhere outside the bones. We call that extramedullary disease. That can be disease that turns up in the body, the organs. It can show up in the skin and soft tissue, which is common. It can, in very rare cases, go to the CNS, although that's very uncommon with myeloma. And so when we do our initial studies, I like to do a PET scan or an MRI because that can also identify tumors elsewhere in the body. It's important in the newly diagnosed setting that even if a patient has myeloma and has a tumor, we often will biopsy the tumor as well, just to make sure we're not missing some other kind of primary malignancy, since it's not usually that common for it to present up front that way. Later on, when patients relapse, it's more common for it to sort of turn into extramedullary disease or disease outside the bones. And so that's something we have to monitor closely after we treat patients. Because extramedullary disease tends to come with a more aggressive behavior. And so it tends to be more difficult to treat. So that's something that we keep a close eye on. And then the last question was
Oh,
about
who's at risk for getting multiple
oh,
myeloma?
who's at risk? Yeah. So as we talked about, myeloma is most common in patients in their 60s. So the median age at diagnosis is 69. So we don't typically see it in pediatric populations, although we do see it in patients as young as in their 30s. But usually it's patients in their 60s and 70s. That's the most common age of diagnosis. And so those patients are at highest risk, older patients who have had maybe this precursor conditions that have now evolved into myeloma. African Americans are more likely to develop myeloma than Caucasians, so 2 times more likely. So it's enriched in the Black or African American population. And men are slightly more likely to develop myeloma than women. But again, we have a broad range of patients who come in. So there's not one particular population that's specifically at risk.